Page number 61, top management tools. So the first tool we'll discuss about is the critical to quality tree. Critical to quality tree. Okay, it's on page number 61 in Six Sigma Greenbelt textbook. So the main thing which you have to remember, if at all you're using this critical to quality tree, is uh, you want to satisfy your customer. Okay, you want to meet the needs of your customer. Okay, so for every needs to meet a particular need of the customer, there are certain requirement which you have to bring into practice. Okay, you have to take an action for that requirement to fulfill that requirement. Once all the requirements related to that particular need is fulfilled, automatically the customer's need will be fulfilled. Okay, so can we take an example of just give an example from your side. Okay, for customer satisfaction, what do you think is a customer's need in a hospital? Just one need from any one department. We'll take that as an example to explain this. Quick consultation. Okay, so we'll take that example. The first example Garima Singh has given. Okay, that is quick consultation. Okay, consultation process should not take a long time. Okay, the patient should not be waiting in the waiting room for OPD consultation and all. Okay, so quickly they want a consultation. That's one need which we have identified. Okay, so put quick consultation under the need category. So drivers, what are the drivers that led to quick consultation? Maybe the patient was waiting for a long time. Okay, waiting time was one of the driver that brought us to this need. Okay, crowding, we as a management we saw that the waiting area is full of patients, there is no place to walk also. Okay, it's full of patients, so we saw another driver, that is crowding. From the management side we identified that, from the patient's side, also from the management side, waiting time was a concern. So driver one means waiting time. Driver two was overcrowding. Okay, we don't want overcrowding in the hospital because infections can transmit way too easy. Okay, then driver three was we did not have enough staff. Okay, we did not have enough staff. So to reduce the waiting time, to take care of this driver one, what is the requirement which we need? We may require more rooms, consultation rooms. Okay, so that is requirement one, more consultation room, appointment system. Okay, have more consultation rooms, have more appointment, have a very strict appointment system. So that is requirement one and requirement two fulfilled. Okay, as soon as you fulfill this thing, appointment system and more consultation room, automatically the waiting time will be reduced. One thing is taken care of. Second, what was the second driver? It was overcrowding. Okay, so so over for to prevent overcrowding, we can see the statistics of the hospital which day. Okay, because if you take the statistics from OPD consultations, you will find there are particular days and particular times when the OPD has highest number of patients. So identify why is that. Okay, maybe they are seeking one particular doctor only. Okay, they want that specialist doctor only, they don't want other doctors, they want that particular doctor only for that consultation. So you have to increase the consultation times, you have to reschedule the doctor's timings to accommodate maximum patients throughout the week. So automatically crowding will come, uh, will slow down. Again, appointment system will also slow down the crowding. Okay, so like that we can take care of driver two. Then driver three, what was driver three? I forgot about that. Driver one was waiting time. Driver two was overcrowding. Driver three was, I guess, no, having more staffs. Did anyone make a note of that? So let's take driver three as less staff. Okay, so we have to hire more staff. Okay, we have to hire more qualified and skilled staff. Okay, so that in that way requirement 5 and requirement 6 will be taken care of. So we took care of all these requirements. Okay, so automatically what is happening when these requirements come into practice, when it is been formulated into the system, it has been put down, it is put down into actions, what happens, the need which the first need which we had identified was quick consultation, that is taking place. Earlier it was taking too much long, it was taking a lot of time to get a consultation, patients were waiting for a number of time, and consultants were also very few, they were overworked. Now after taking bringing all these changes, putting a check to in front of all these requirements, you took care of the customer's need. So that is critical to quality tree. You can use this in any aspects of healthcare system. Okay, next is flow charts and the process map charts. So it is used in the defined phase. I have explained that earlier also. Defined phase means what is the current scenario without any future changes, you have not implemented any future changes, what is happening in the present, put that into a flow chart. Okay, that is flow charts or process map. Okay, so this is a typical process map of how an emergency department works. Okay, so the patient will be assessed, vital signs and everything will be taken care of, history will be taken from the patient or the patient party. Critical intervention, because they're coming to the emergency department, first aid, critical intervention will be given according to the triage. In the emergency department there is a triage, the people who are very critical, they will be in red zone, medium critical in yellow zone, the patient who doesn't require like quick care, but they can wait for their turn, they will be in the green zone. So that is a triad system within a emergency department. So critical interventions will be done. If the patient uh, is stabilized, okay, they can be discharged, and if they are not stabilized, they require further treatment, they have to go into the inpatient ward, or they may have to go to the OT for surgery. Okay, so that is how a typical flow chart works. Okay, so how from the point when the patient enters your hospital, what all things he or she has to undergo. Okay, everything will be, what is happening in the current scenario in your hospital, everything will be put down in a flow chart. Okay, this is not same for all hospitals, it may the flow chart may differ, this is just an example. Okay, so what is the current situation, put that in a use arrows, or without using arrows you can use the lines to show where the patient has to go. Okay, which department the patient has to go. Okay, the current practice, it is put into the flow charts and process chart. Then you can take a screenshot of this, take a screenshot of flow chart and process map, because we have to compare this to the next topic. So keep that screenshot ready with you. So next is the workflow diagram. Just compare this image to the screenshot which you have took, the screenshot of the process chart or flow chart. Just compare these two images, and can anyone just tell me in the chat box what is the difference between these two images? Look at the screen for workflow diagram. Look at the screenshot which you have took recently for the flowchart or process map. Compare these two images, and can anyone tell in the chat box what is the difference? Yeah, movement of doctors and persons. So when you compare, um, when you look at a workflow diagram, when a patient is entering this workflow scenario, where the patient has to take a turn to reach what department, everything is given. Like from this point of view, okay, you can just looking at the workflow diagram, you can understand without even going to this particular setup, without even physically going to this particular hospital or department, you will have an idea where the laboratories are, where the x-ray is, okay, where the administrative area is, where the reception is, where the vital signs and initial checkup and first examinations will be taken care of, where the patient will get treatment, each and every place. Okay, a third party, a third person who has not even visited this facility will understand. And just looking at the arrows, one will know, okay, I have to enter from this area, I have to go to this area to get my vitals done, examination done, I will be getting my treatment here, then I will go to the x-ray or lab as directed from my by my physician. Okay, I will get the report and I will go to the final diagnosis area. If I require follow up, I don't have to go all this way. When I'm coming for the second time in the follow up, I have to directly go here. Okay, so that a third party can understand just by looking at the workflow diagram. Third party can understand where and all he or she has to take turn. Okay, which department is next to which department, you can understand. But you can't say the same for process map. You just know, you just have an idea, you do not have any idea about the physical department. Only thing you know is when I enter the hospital, they will do my assessment, they will do my treatment, then they will either transport me to the inpatient ward or they will discharge me. Okay, that is what uh, the patient will know. But looking at the workflow, it will give much more in-depth details, not just about how the patients will move. Okay, this may be about how the patient has to move, but in other workflow chart from the nurse's point of view, from the doctor's point of view, from the technician's point of view, it will be different. Okay, where they have to move, okay, how far is their one station of work to the next station of work, that can be understood with workflow diagram. Okay, movement of people, materials, paperwork, okay, information, everything during a given process. And you take any process, take admission process, you can make a flow chart out of that if you know which department lies where. Okay, take MRT or billing area, that in that also internal billing staff may have a flow chart. Not from external, you will not be entering into the billing department. There is a counter, you can go only up to the counter, not beyond that. But within the billing department, for the billing staff, there will be a workflow diagram. Okay, so workflow diagram will help you to know where there is a lot of crowding taking place. Can you change the tables? Can you rearrange the tables, or can you make some renovations within the department so that too much of workflow is not there? Okay, too much of work jumping in front of each other, too much of crowding is not there, too much of information, people, or any paperwork getting stuck in a workflow is not there. Okay, so that's the idea of a workflow diagram. Okay, so next you have histogram and bar chart. You can just look at these two images and identify what is different. So continuous data can be displayed on a histogram. There is no space between each bars in a histogram. In bar graph, each bar is a special category. Like this, the first bar is the category for Tokyo, second for Chicago, New York, Boston, Atlanta. Okay, each bar is of a different category. But in histogram, in x-axis, it is the same category. There is no differentiation. Only the differentiation will be the data. It will be continuous data. Okay, and in bar graph, it is discrete data. Okay, girls or boys, discrete data. Age is a continuous data. 0 to 20, 20 to 40, continuous data. Okay, so that is how bar graph is different from histogram. This you can read about in the book. Then you have pie chart, again a very simple chart to be explained. Okay, all the composition, the proportional segments of each category, you can just by looking at a pie chart, you can understand which proportion, proportion is too much for one category, which has the minimum proportion, etc. So that data can be understood, and even the proportion of one category in respect to other category comparison is very easy. Okay, just looking at the pie chart, you can do a quick comparison. So that's about pie chart. Line chart. Okay, line chart, the main thing is time. X axis will have time. Okay, first you will put all the data points. First you will graphically dot, like dot of all the data points, then you will use a ruler to join each points, then you will get a line graph. So over a period of time, what trend is going on can be understood by using a line chart. Okay, for example, the temperature of a patient from morning to evening. If you are dealing with a malaria patient, okay, or a dengue patient, from because there is an intermittent fever in that case. So line chart in morning, 6 o'clock, what was the temperature? After 2 hours, what is the temperature? Okay, you will get a trend just by looking at the trend. Even if you had not made the diagnosis yet, you can say it can be. There are high chances that this can be a vector-borne disease because of intermittent fevers. Okay, so that's how line chart helps. And over a point of time also, throughout the year, okay, which month you had highest number of patients, okay, and why so? Like July, August, September, October, you had the highest number of patients. Why? Because infectious diseases will travel very soon when during humid climates and all. Okay, so that's one. That's how you get an information from a line chart. Then affinity diagram. Okay, can anyone explain here? Is the screen visible to all? So affinity diagram, just by looking at these two images, it's very simple. Can anyone just state what this images is trying to say about affinity diagram? Sorting out different topics. Yes. For example, let's say uh, discussion was going on here in this particular conference, maybe like we are going to rebrand ourselves. Okay, so a company is going to rebrand themselves. They want to reintroduce themselves in the market with some new terms or something, like what happened with Fair and Lovely. Now it is Glow and Lovely. They did the rebranding, okay, after too much of backlash and all. So that's an example of rebranding. Okay, so all the employees who were present in that conference room, they must have given n number of ideas. Okay, large amount of ideas were given by the employees. All the ideas were put, they used that ideas, they either wrote the ideas, or they used clip on post-it notes to clip it on the whiteboard. Okay, after that, after all the ideas were exhausted, they will categorize each idea. Okay, they will categorize each idea in terms of different aspects of rebranding. Maybe they have to improve the quality of their product, their service, customer service, they have to improve. Delivery, if it is an online industry, they have to take care of the issues from the delivery aspect. Pricing, they have, when they're doing rebranding, sometimes it does, most of the time it will affect the pricing also. Okay, so they got 100 ideas, they have to sort out the 100 ideas into certain number of categories to understand, also to understand that which idea, which category has requires more work to be done on from the employee's point of view. Okay, the category which has the highest number of post-it notes, or highest number of people giving putting pressure to take care of that particular category, Means you have to start your work first in that particular category. Okay, that's how affinity diagram will help. Then you have Pareto chart. Okay, so in Pareto, you have to remember the principle of 80-20. Okay, so the principle basically states that 80% of the complaint will happen just because 20% of the reasons. Okay, and if we solve this top 20 reasons, 80% of your problems will be solved. Understood? So the 20 these 20% of the issues which is costing a lot, which is costing 80% of resources of the hospital. If you take care of this 20%, this 20% is called vital few. Okay, 20 is a relatively small number as compared to 80, so it is few, but this 20% is very vital, because just by taking care of this 20% of the issues, you will be solving 80% of your problem. So that is Pareto diagram. Okay, and trivial many means small issues. Okay, for example, give me 2 examples in the chat box which you think in India. Okay, as a country in India, what are the 2 main challenges of healthcare? If you think that if you take care of these 2 things, these 2 main issues, okay, these 2 main issues, 80% of the health problems of your country will be solved. It's a very vague question, but yes, the main thing is very few doctors and medical staff. Okay, even if for example, there is, if you go by the ratio, even as of now in the 21st century, there is 1 doctor for every 1,000 to 1,500 patients. Okay, that's the ratio which we are looking at. Okay, there is only 1 nurse for every 70 to 80 patients. Because of the population demand, we are a very populous country. So one thing is having enough number of skilled and qualified medical staff in the country. Okay, that will take care of 80% of the healthcare issues which the country is facing. That is one of the main reasons. Okay, we are understaffed. We are heavily understaffed when it comes to medical care. Okay, then is the supply, medical supplies. Okay, that also we are extremely undersupplied. These 2 things, if we have enough medical staff and enough medical supply, okay, most of the health problems of the country, 80% of the health problems of the country will be taken care of. Okay, governance and other things are other trivial many. Okay, that they can sometimes the central decisions and the state decisions from the top government agencies, that will come under the vital few, but other local level government or third party government decisions and everything, that will come under the trivial many. So that's how we can use Pareto diagram. So this is the principle. 20% of the input accounts for 80% of the output. Cause and effect diagram. It is called the Ishikawa diagram or the fishbone diagram. That's another names for cause and effect diagram. So that can also come for a question like, what is another name for cause and effect diagram? Okay, and few names can be listed out. So you have to know what is the other name, because Ishikawa fishbone diagram is like, it's a very common tool used in Six Sigma. Okay, because if you want to solve something is going wrong, you want to understand why things are going wrong. Okay, from different aspects, why things are going wrong, you have to take care of each and every small trivial issues, then only you can achieve the best quality at the end. Okay, so there is a problem. Okay, any problem can be caused by or by the combination of all these factors, or maybe because of few factors. Okay, for example, Let's take the uh, lift broke down during the working hours. Okay, the lift broke down and the lift was not functioning. Okay, so from the machine point of view, from the machine's point of view, what can you say? You can put it in the chat box. From the machine point of view, what can you say? The problem was unexpectedly the lift had a failure. The lift was not functioning, malfunctioning lift during the working hours in a hospital. From the machine's point of view, what may be the cause? Yeah, engineering team did not do regular check. That will come under man. Okay, that will come under man. Regular maintenance not done will come under method. From the machine's point of view, you have to get technical. Yes, the machine is old, right? The machine was old, or maybe that a particular part in the machine didn't work. Electricity was cut off for that particular lift unexpectedly. The electrical wires was not functioning. So you have to get that technical. Okay, so from the machine's point of view, that's an issue. People didn't do the didn't do the maintenance. Okay, regular maintenance was not done. That's a man's issue, because the people is a person is responsible, because it was supposed to be done in policies. It is their maintenance has to be done, but nobody carried out. So that's the issue of the man. Okay, even if the duty was assigned, that particular person didn't go for preventive maintenance. Understood. So that's the issue. That's the cause which we have found because of the man. In method, maybe uh, the manual or the schedule of maintenance, who is supposed to do the preventive maintenance on which particular day, that schedule was not made. Okay, maybe the manual was not there. You didn't you The department, the maintenance department didn't store the manual for the lift. Okay, they lost it. Everything will come under the method. Okay, material, maybe the quality of the lift they used in the first place was of inferior quality. Understood. Or if even if the lift was of good quality, the electrical wires, the supplies, the architectural integrity of the hospital was not up to the mark, inferior quality. Okay, that will be the material. Understood. So this is how we can make a cause and effect diagram. There are few other aspects also for cause and effect diagram apart from man, machine, material, method. It is given the textbook. Example is also given. When you read that image, you will understand. Okay. So you know what may be the problem that has caused this, but what may be the causes which may have led to the problem. But you should also know where to put these causes. Okay, you should know which if this person didn't do the maintenance, you're talking about a person, so it has to come under man. Okay, the lift was of bad quality, the architectural integrity was not strong, that is material. Okay, policy makers didn't make good policy, manual was not kept properly, the maintenance department lost the manual. Okay, they do not have a schedule for preventive maintenance. Okay, that is method. Okay, something a technical issues will come under the machines part. Okay, so that you should know where to put what costs. Then you have 5 eye technique. Okay, it's the same thing. When you want to write up, okay, for now we understood, and in this Ishikawa, in machine what all causes will come, method what all causes will come, man what cost will come, materials what cost will come. How did you got these causes? From where did somebody has to tell you? Okay, somebody has to tell you only when you ask questions. So that is 5 eye technique. Define the problem. The lift broke down, why was it happening? You will get n number of causes. You have to ask why. You will finally get the root cause for each. For machine you will get the root cause, for man you will get the root cause. Okay, so this is also 5 eye technique will lead you to the root cause. And what is root cause? Cause and effect diagram, root cause analysis diagram, Ishikawa diagram or fishbone. Okay, so this is also very easy. Just ask why, questions made up of why 5 times. You will finally get the root cause. You can go beyond five times also if you are not satisfied with the answers which you get. Then you have scatter diagram. So in scatter diagram, you have positive correlation, negative correlation, and no correlation. Okay, just by looking at the graph, I have explained this earlier also in other classes. So positive correlation, just by looking at this graph in the extreme left, okay, how do you explain it? In brief. Don't give the examples, because examples, when you read the examples, it is very easy. But without example, how do you explain a positive correlation? One factor affecting another factor itself is called correlation. Okay, that's the definition of correlation. So in positive correlation, things are directly proportional. Okay, when there is an increase in one factor, there will be the increase in another factor. For example, if you have, apart from the example which is given in the textbook, okay, if you have enough qualified, skilled people in your workforce, okay, there is an increase, more number of qualified, skilled people who can really take care of your patients well, automatically your customer satisfaction will increase. Understood? Negative correlation, um, for example, increase in hospital acquired, healthcare acquired infection. How will it affect the quality? There is an increase in y-axis. Let's take hospital acquired infections are here in the y-axis, and x-axis is quality. It is inversely proportional. Okay, as soon as there is an increase in hospital acquired infection, the quality of your healthcare will fall down. Negative correlation. Okay, no correlation means there is no effect of one factor over the other. Okay, no correlation. Okay, so for example, in the textbook it is given having apple every day and getting needle stick injuries. There is no correlation. Needle stick injuries are incidental if you are not paying proper attention to the procedure. Okay, it is most of the time it is incidental. So having eating proper food or proper medications or anything is not going to help you from getting needle stick injury. There are other factors to it. Okay, so that's the scatter diagram. So in scatter diagram, at various days, okay, different days over a period of time, you will plot each dots. Okay, and these dots will show you a trend. All the dots, maximum number of the dots will be, the data will not be same, but it is relatively same. So all the dots will be gathering together. So just by looking at the gather, if it is an upward line which has been formed, it is positive correlation. If the dots have gathered in such a way that it is showing a downward slope, that is negative correlation. And if you can't find any line whatsoever, that's no correlation. Okay, then you have run chart. Run chart is very similar to the line chart. Over a period of time, okay, you will plot the observations. For example, let's take COVID cases here. Okay, no correlation. There is no effect of one factor over the other. They are not at all related. Okay, the effect of one factor is not going to affect the other. Okay. Yeah. For example, so in run chart, we will take COVID, okay, for COVID cases. So when over a period of time, we are seeing, okay, today how many cases we had, next day how many cases we had. Okay, over a period of time, every day we are having a number at the end of the day. That's the number of COVID cases which we are facing. Okay, so shift means there is a shift in that trend means either the shift will be more than 6 points above, and this 6 points means it doesn't mean 1 2 3 4 5 6. Okay, that's not how it is. You the 6 points is relative to the points which you are taking at the uh, this y-axis. Okay, it can be 100 200. Here they have took 10 20 30 and all, so it may be 1 2 3 4 5 6. But if you are putting it in like 1000 2000 3000, so if it is 6 points above, means today there was only 1000 cases, but tomorrow, okay, when at the end of the day you got the report, it was around 6000. Okay, so it was above 6 points. So that means that it's a shift. You have to make an immediate decision over here. Okay, the shift, any shift which is more than 6 points above or below the central line. Okay, over the period of time, from even the times when we had waves, we had 3 waves and all. So from the first day to till today, okay, whatever COVID cases we had, take an average of that, you will get a number. So you want that number should be the average seen throughout until you get a solution for this pandemic. Okay, but if there is a sudden increase, okay, sudden deviation from this median, okay, you will have to assess. Okay, you can predict there is something coming up, there is a third wave maybe coming up. So this you can see astronomical data here. This means a third wave or second wave, whatever wave we had, when you got n number of large number of cases during the same time. So it astronomical data means it is the highest peak point. Okay, usually all the waves which we have witnessed, COVID waves which we have witnessed, those will come under the astronomical data. Then we have trend. Trend is 5 points up or down, that is normal. 5 points up or down the central line, 5 points up or down the median line or average number, that is normal, that's a trend. Okay, you can see when it is going down, when it is coming up, it is kind of normal. Okay, so that's how the run chart works. Then you have control chart. Okay, in control chart, take an example of a normal blood pressure. Okay, uh, uh, the hospitals may use certain different approaches to have a definition for normal blood pressure. But just for here, for your knowledge sake, can anyone tell me what will be the uh, lowest point of a normal blood pressure, below which it is very critical? If the blood pressure goes below this particular point, okay, it is very critical. Hypotension. What will be the value of hypotension? What you are aware of? There is a normal range of blood pressure. Okay, 120 by 80 is like very common, but 120 by 80 is not the normal blood pressure. There is a normal range of blood pressure. Okay, if you do not have 120 by 80, it doesn't mean that you are abnormal. Okay, that's another discussion. So there's a normal range. What is the lowest range from your understanding, if you know what blood pressure is? Okay, the systolic blood pressure, if it is 60 mm of Hg, please mention that also. If it is it systolic or diastolic. Okay, if the systolic blood pressure goes below 60 mm of Hg, means it is critical. No, 60 should be, yeah, 90, yeah. 90 by 60 is the lower range. True, 90 by 60 is the lower range of blood pressure. So that should be the lower control limit. Understand? Okay, lower control limit should be 90 by 60. Anything going beyond that, that is out of control point, it's a special cause, immediate action has to be taken care of. So what will be the upper limit, upper control limit in blood pressure? 90 by 60 being the lower control limit, what will be the upper control limit? What is the maximum your blood pressure should go, but not beyond that, even if you're resting or not? 140 and above. Okay, your blood pressure should not go beyond 140, especially when you're resting. It should not go beyond 140. Okay, if you're working, walking and all, you can take at least 150 or 155. Okay, but beyond that, your blood pressure should not go, systolic especially. Okay, so upper control limit, let's take 140. 140 by 100 mm of Hg should be the upper control limit. If the BP goes beyond the upper control limit, again it will be out of control point. It will be a special cause effect. Just because in the diagram they have shown uh, a trend that is going beyond lower count, only that is called out of control point. No, anything that is going beyond these two red lines, upper control limit and lower control limit, anything going beyond these two red lines is called the outer control point, special cause variation. Okay, common cause variation, special cause variation. If you remember certain topics which we did take in quality, special cause variation, common cause variation. Okay, so that's how we explain it. Common cause variation means when the BP is fluctuating between 90 by 80, 110 by 90. Okay, like that, it is fluctuating. So that is common cause variation. Okay, so that's about control chart. Then we have process sheet. Okay, so a process sheet, you have to understand here is each and every step that you take in your department. Okay, if you take the entire hospital, it will be too vague, but each and every step, each and everything which we do in our department, is that action bringing some value or adding some value? Okay, so there are certain actions which will not add direct value, but indirectly it can add value. Okay, direct value and indirect value. For example, consultation. Okay, the doctor who is doing consultation in OP. Okay, he is coming. He is doing the taking the family history of the patient, doing the assessment. Okay, asking questions about the symptoms and everything. Okay, so that's an action that is adding value because the patient is going to pay for that. There will be a nurse who is assisting the doctor. Okay, she may be taking the notes. She may be taking the vital signs of the patient before the patient meets the doctor. Okay, the patient is not going to pay the nurse anything. The patient is going to give money for the consultation only, that specific doctor's consultation. It doesn't mean the nurse has not brought a value. She has brought an indirect value because she has recorded the medical data of the patient by taking the vital signs. She has created a medical record. She has charted the vital signs in the medical record. Okay, that will go into the MRD department. It can come into use for in the future. and it will be used by the doctor for the diagnosis also. So that's non-value added procedure, but it has an indirect value. So in process sheet, in every department will have a process sheet. What all steps are taken in the department, you will write it here. Okay, and here we have process capacity shift that you can assume as value. Okay, how much value this particular step adds in terms of rupees, or in terms of growth, in terms of satisfaction, anything what you consider value for that particular department in that area. Okay, either add some numbers or subtract some numbers, or leave it as it is. So at the end of the day, when you look at the process sheet, you will understand which all processes are very important, very critical, because they add direct value. Which are the steps that are non-critical, okay, non-value added steps. Even if you remove that, it is not going to affect your it is not going to affect the normal process flow in your department. Okay, some steps you can avoid just to streamline the entire process, especially when you are bringing in Lean Six Sigma into this area. Okay, you need a process sheet, because you have to identify, especially when you do a lean, you're not doing Six Sigma, at least lean if you're doing, you should you will require a process sheet to identify each and every action taken in the department, what value this action is bringing. If it is not bringing any value, it is not adding it is not even bringing in that value, remove that step. That is how you streamline the process with the help of process sheet. Then you have Gantt chart. So Gantt chart, remember that the entire project which you have to do, for example, you are planning a conference. Okay, in the month of July, you are planning a conference. From January itself, you will uh, start the topic. Okay, on what will be the topic on which we will have subtopics, and who will be the person who will be inaugurating your conference, who are the key spokespersons in your conference, how long the conference should last, is it a 3-day conference, 4-day conference, 1-day conference. Okay, everything will be decided, planning will take place. Okay, it will go up till March, because the person whom you are like inviting for your conference, earlier in January they were available, but by March they say that they are not available, please find someone else. Okay, so planning will lag on up to 3 months. Okay, almost 3 months. And here you can see at the last from the last weeks of January, the planning should start. Okay, because in the mid July, you have to from the starting part of the July, you have to implement the conference. Okay, follow up will be done later. But okay, so the Gantt chart will show you. Okay, you have not at all started anything. Okay, you just have a concept of a conference. It has to be held in July. What all things we have to do. Okay, in the you will plot a Gantt chart, all the major steps which you have to take up. Okay, research and everything will be taken up by the key spokesperson who want to do the conference. Okay, they will have minor researches and studies done. They will give you, they will submit their studies and thesis, or whatever they want to show present in the conference, they will submit that. Okay, so that time you have to give it to them. Design phase, you will identify which conference hall has to be booked, how will be the decorations be. Okay, how many seating arrangement should be there, how many participants you are expecting. Okay, all these things has to be done. So an implementation phase, caterers, everyone, you will go place the order, you will go and place the order for the conference room, everything. Okay, and finally conference will take place. Okay, in follow up media relations, you will submit your conference segments in pieces by pieces to the media. Okay, that's how the entire Gantt chart work. So just by looking at the Gantt chart, you will understand from starting to end at what point of the time you have to start this category of work. It should not delay more than that. It should not we should not start before this, otherwise it will cause a lot of haphazard confusing situation. So uh, using a Gantt chart, you will have an idea when to start a certain process, by when to end it, other processes when it has to start. Okay, the entire idea can be briefed in this particular chart. Just by a single look at this chart, you will understand when is the deadline, by when you have to complete, and at what time of the year this particular process has to take place. So that's Gantt chart. So any doubts so far?